Good morning. I'm Alex Scott. I'm the branch secretary of the Together branch. We'll be starting our presentation in relation to the COVID mandate in schools in a couple of minutes. We've just started the webinar, so we're just waiting for people to come online before we formally kick it off. So we want to try and make today's briefing reasonably tight in terms of time frames. We're going to try and keep it to about half an hour. Most of today we'll be talking about what we don't know rather than what we do know, but we'll be doing a series of these presentations over the next couple of weeks, even after the end of term, to try and provide you with the maximum information possible. So to start off again, my name's Alex Scott. I'm the branch secretary of Together. Before we start, I'd like to acknowledge the traditional owners on the lands we're meeting across the state and pay my respects to their elders past, present and emerging. In terms of today, what we are looking at is a presentation for our members in schools in relation to the announcements made by the Chief Health Officer and the government yesterday. In terms of that, clearly what we have seen is an announcement in relation to the mandation of vaccinations for COVID-19 for workers within the school environment. At this time, there is an announcement, not a decision. So when the Chief Health Officer makes a health directive, that health directive is quite detailed in writing and is posted on the website with an operative date. What we have yesterday is the announcement from the Chief Health Officer and from the government that they have made a decision is going to be made, but it doesn't become law until we actually see the gazettal of the announcement of that on the website, and it's issuing in writing. So at this point in time, we are unable to provide exact legal advice in relation to what will happen, because we actually haven't seen what is going to be the final wording. And I think the wording is still a kind of a progress process that they are still working on some of the exact processes, and so therefore working on the exact wording. But that announcement will also be covering a range of areas such as prisons and youth detention centres, and may or may not be part of the broader CHO decision in relation to pubs and clubs that was announced a couple of weeks ago, but yet has still yet to become decision making. But so the information we'll provide today will try and cover what we do know from the announcement, what our best guess is as to where it's going to look, what's going to look like, and what we think is going to be our best advice as it goes forward. This advice is accurate as at 10:30 today, being Wednesday, so we will try and update you as regularly as possible, but there is a long way to go. What we do know in terms of this is that there is going to be a significant impact of COVID next year, irrespective of what happens in relation to the mandate or otherwise. The vaccination process will significantly reduce the severity of COVID and will significantly reduce the numbers, and we believe will also likely to be reducing the transmissibility of COVID, but it won't reduce it. No matter what happens in COVID, in terms of vaccinations or otherwise, there will be COVID coming through Queensland next year. To what extent that's affected by some of the new variant, nobody knows at all, because the new variant's only been known for a couple of days. It might be more transmissional, it might be worse, it might be better, but there is a whole lot of unknowns moving forward in relation to the health activity that's going to come as the pandemic comes through Queensland. And so in terms of that process, we need to be clear that in terms of this process, this is about a mitigation factor. It's not going to avoid COVID coming through Queensland next year. As part of that process, there are a range of ways that government, both as a government but also as an employer, can require people to be vaccinated. Clearly, from a Together point of view, as a health union, we support the notion of vaccination. We believe that vaccinations are something that will be a significant component of the health response in relation to COVID. Whether those things should then be mandated is a different question to whether we believe in vaccinations. But in terms of that process, there are a variety of ways that vaccinations can be mandated. Some of those can be through a CHO directive, Chief Health Officer directive. Some of those could be legislated, and some of those can be where the employer chooses to mandate. In terms of that process, there's been no discussion of legislation in Queensland. So the two options really are whether there's a health directive issued by the CHO or whether there's an employer directive. In terms of that, up till now in the public service and the public sector, there has been employer mandates. Queensland Health staff are mandated to be vaccinated. They had to be vaccinated within certain timeframes, but that was a decision of the Chief Executive and the Director General, rather than the Chief Health Officer. And then the Queensland Police Commissioner made a similar decision as the employer. So in terms of that process, there needs to be a clear understanding that what we're looking at in schools is not what happened in Queensland Health and is not what happened in the Queensland Police Service, because they were decisions by the employer using their reserve powers under the Public Service Act and general powers employers have, rather than the Chief Health Officer. In other states, the Chief Health Officers have made much more extensive decisions in relation to mandating. So particularly in New South Wales and Victoria, where they've had much higher levels of COVID going through the community over the last 12 months, the Chief Health Officer has made decisions that mandate large areas of the workforce. And so if you look at AFL players, football players in Victoria, the Chief Health Officer has said that football players, because of their definitions are so broad, must be mandated. In Queensland, that hasn't been the case up till the last week or so. And in the last week, what we have seen has been a decision by the Chief Health Officer issuing a directive that goes beyond what the Queensland Health was doing for employees to dealing with both public and private sector work sites, health work sites. So hospitals, both public and private, are now covered by a CHO mandate. And the big difference between an employer mandate and a CHO mandate is the employer mandate covers employees, and it's by definition who are workers and who they're employed by is caught by. The Chief Health Officer mandates are significantly broader because they're not related to employment, they're related to work sites or work locations. So we've seen that directive issued in relation to private hospitals and public hospitals, and that gives us some understanding of where we think the CHO might go in relation to schools, as opposed to looking at what happened for police and police, which was where the police commissioner made choices as the employer. But that directive has not been issued. What we saw yesterday was an announcement of a decision rather than a decision itself. And so this fits within the same category as the pubs and clubs and the entertainment industry that has been announced, but the actual decision hasn't been released, and so therefore hasn't become lawful yet, but we know it's coming. And that announcement was that the CHO would mandate in relation to schools and corrections, both public and non-government and non-government schools in the school setting. What that looks like then in terms of our advice to you today is based on what the media has said, what the politicians have said, and some briefings we've had as recently as 5 minutes ago from the government department in terms of Education Queensland, but also from some of the central agencies. But we can't give accurate and detailed advice yet because we're having to work off what people are saying rather than being able to give you the written advice in relation to what that directive looks like. So in terms of that, what we do know though in terms of that is that in terms of the employer stuff, all the things you would have seen previously in relation to health and in relation to police was that the employer directions were lawful. What we know from a legal point of view that in police and in the public sector health area, the employer was challenged in the Industrial Relations Commission in relation to whether it was a reasonable decision. And there's been a bunch of challenges in relation to private employers such as BHP, Qantas, Woolies, a range of employers that are now being challenged about whether they can mandate for their employees. What we know is through the court processes, through the Industrial Relations Commission in Queensland and also in relation to the Fair Work Commission for private sector employers, is that they do have the power to mandate. And that's not a legislative power, that's just a power that they have generally. And there's a range of issues how that applies. What we know though is now in schools is we're not facing an employer mandate. We might be facing an employer mandate for part of education in terms of regional office or head office, but for schools will be a CHO mandate. And the CHO mandate has a higher level of legal strength than an employer mandate because they're just using generic reserve powers. The CHO mandate is going to be much stronger in its robustness in terms of being challengeable. It's highly unlikely, given some of the Supreme Court action in New South Wales in relation to CHO processes and ministerial processes. Given the fact that the courts are saying employers can do this, it's highly likely that the courts will go even further in relation to the CHO process, saying that this is an appropriate response in relation to mandate. So in terms of this, we're not putting this in writing, but our advice is we think it's highly unlikely that there'll be any successful challenge in relation to that. There has been no challenges in relation to the kind of CHO processes because they weren't relevant in terms of health and police, but even the employer was proven by the Industrial Commission and has been considered by the Supreme Court in relation to in terms of that employment process. But the key trigger dates are around the fact that we know that the borders are partially open now. We've then got school term finishing for most public service, most Queensland government schools on the 10th, some regional ones and some of the non-government ones finishing earlier than that. But the 17th of December is the date that they've chosen to trigger a whole lot of things, originally around the pubs and clubs and then visitors to prisons, and now in schools, is to say the 17th of December is a key date because that was the date that was chosen when we were going to get to 8%. We're now going to get to that earlier, but they're still working on the 18th of December being a date that the roadmap is for opening of the interstate borders. And the second key date then is the day before school starts in 2022, being the 23rd of January. So what the CHO announcement is, and what we believe the CHO decision will be, is that people must be vaccinated, the first vaccination rate by the 17th of December, and the second double vaxxed by the 23rd of January next year. And that will be kind of where what they're likely to be in terms of that process. And now we're in a kind of period where prior to hopefully the 10th of December, the government is trying at a departmental level is trying to work through what this means, because they have no ability to change the CHO directive. We're in schools and we're in police. The Police Commission had some capacity to vary what she was doing because it was her choice. Education Queensland is going to have to implement what the CHO decides. And what that CHO decides isn't yet written. And so in terms of what some of this looks like, we can talk through what it looks like in terms of process based on our experience in what's happened up till now. But at this point in time, we get into our advice rather than technical ability to say exactly what's going to happen. But what we know by the 23rd of January is that it's highly likely that the CHO directive will say you can't work in a school environment if you're not double vaxxed. And in terms of that process, there will be, prior to the 23rd, we're not sure on the timeframes, some ability to seek an exemption on that basis. Those exemptions won't be on the same basis as what happened in relation to health, for Queensland Health and for the Queensland Police Service, because those weren't CHO mandated, they were employer mandated. But there'll be some process, which is our best guess at this point in time, is going to look similar to the CHO mandate for private hospitals as it exists. So it's likely to be far more constrained than the options that were available in terms of mandating for seeking exemption for our members in police, and is more likely to be limited just to health advice and having health evidence as to what that looks like. In terms of then, I think then the other parts of that going to be what happens in terms of appeals in relation to that, and I think that's going to be quite a grey area. There was supposed to be a meeting with the Public Service Commission this afternoon to talk about the sector-wide response, which effectively is what's going to happen in schools and corrections in relation to mandated areas by the CHO. That meeting's now been put off till next Monday afternoon. So it's unlike, so we aren't able to provide much advice. The teleconference I just came off with the government, with the department, education department, was that they weren't able to provide advice until I'd seen what the PSC position was. So we're still 4 or 5 days away from knowing exactly what that is going to look like. But what I think is likely is that there will be some sort of exemption process, which will be CHO based, probably more narrow around its medical requirements if it follows the private health model than was available for our police service members. And then in likelihood, once again, we don't know exactly what this is going to look like. What's happened for our members in police and health is that once those deadlines pass, people are then suspended and are then going through a process in relation to disciplinary action. Clearly, if you are unvaccinated by the 23rd of January next year, but if the CHO process follows the announcement and actually becomes law, you'll be unable to work and you'll be unable to visit a school environment because of the CHO decision. And what that looks like in the police service at the moment and in the Queensland Health Service is people are being suspended, and then they go through a show cause process that is where the threat is that it's likely to end up in termination. We haven't got to that stage yet within the Queensland Police Service or within Queensland Health, but certainly that is the logical conclusion of the process that has been commenced. We would expect, and our advice to members is that is likely to be what is going to follow in relation to the school system. We will continue through the negotiations over the next kind of 7 days as we expect them, or 10 days as we get closer to the end of school, because we think that's going to be a key date when they have to have issued the directive or the mandate, is to try and protect our members during this process and get the best possible structure and process we can to provide you with individual support in terms of people who are unable to be vaccinated for a variety of reasons. But we aren't able to until we see next week what this looks like. The advice is there is going to be deafening silence from the department, because they're still, as a department, as a public service commission, as a government, waiting to see what the CHO decides and then working through the HR implications of what that looks like, particularly in a corrections environment. Is going to be far more significant than a schools environment, because the significant number of schools members won't be at school after schools close, but corrections facilities are likely to have the same dates as school facilities, and so therefore the 17th of December is likely to be a key date around possible suspension for correctional members, and then the 23rd being a further one for correctional members. And I think if there's a sector-wide response, the fact that more than just schools are affected are likely to mean that even though there are lots of people who are going to be in a situation of not having to go to work, are still going to have the conversation around what it looks like in terms of the employer seeking information from you as to whether or not you have been vaccinated, and starting disciplinary action potentially for those people who refuse to answer, or those people who say that they're not vaccinated and are going to refuse to get vaccinated and have gone through the various exemption processes that may exist at that point in time. Clearly, we know that there are more questions than we have answers at the moment. Last night, Together put a number of questions back to the department. We're still getting almost no answers in relation to this. What we do know, though, is a CHO mandate rather than an employer mandate. So it's likely that anybody who's going on in a general sense, understanding of what this means would be that it's likely people who are going into schools who are performing some sort of work or activity or for the school are likely to be caught. So a parent dropping off kids and doing just that as a parent won't get caught, but a parent who goes in and kind of starts to being a volunteer is likely to get caught. We can't give you an absolute answer on that yet, because they haven't issued the directive and they can't give us absolute answers until the mandate has been delivered. Then we are going to have a bunch of our members also who don't work in schools, who are employed elsewhere in the department, who visit schools but don't have that as their primary employment status. And so they're going to get caught in this environment as well, as to if you're employed in central office or regional office, but 90% of your time is in schools, you're not going to be able to visit those schools, and what that looks like in terms of from a HR point of view and a potential disciplinary process. So there's also going to be a range of issues in relation to for staff who are vaccinated, what do they do in relation to questions around what's going to happen in terms of staffing levels, given there is potentially we believe that the overwhelming majority of our members are vaccinated, but there is a significant minority who aren't. That is going to mean potential issues in relation to not enough staff to do the work come first day one of term one. What's going to happen to that? What's going to happen for people who visit schools in term one or after the 17th of December even, and what the vaccination status look like for those people, and what does that mean for our members in the school system? So in terms of that process, that's what we will try and get as much answers for you as possible. We will continue to pursue those aggressively as we can with the department, but at this stage, our ability to provide that advice is limited, because this is still, as I said, it's an announcement, not the law yet. And in terms of, I think they're trying to clarify and roll out exactly what the wording of the mandate will look like. And that exact wording will be what then is the implications for you as employees and moving forward in terms of the work you do if you are mandated in terms of that. So from a Together point of view, we'll be conducting a ballot of our members starting later today, asking members what their view is. So in terms of a position about what the union policy is in relation to whether or not mandates should occur or not. Clearly, our members have a variety of different views in this space. And what we do in every department, and we did in police and we did in the Queensland Health Service, is that the members in each agency determine our view. And so there will be a ballot where we'll be asking members what your view is. Whether our view is to oppose or support mandate will be determined by members, but even if we oppose it, it's unlikely, given the nature of a CHO directive, we're not going to be able to give any real hope to people to say that we could have this challenge successfully through the courts, given the nature of the current decisions that have come out of the Fair Work Commission, out of the Industrial Relations Commission, and out of the New South Wales Supreme Court. But we do think, as a group of workers, we need for you to be able to make. You should determine the union policy as to whether or not we should be arguing for or against it. But irrespective of that particular decision, we'll then be having to provide as much advice as possible to you. I know it will be a very deeply frustrating time over the next week or so, because we're not going to be able to give you any information in a meaningful sense until we get meaningful information from the department. So we will continue to try and provide these Zooms, which are being recorded today and will be available for people to watch after today, with the proviso that if you're watching it after, if you're not watching it live, things may have changed since it was recorded, and we will continue to do a couple of these over the next couple of weeks and schedule another one later next week. The timing of it will a bit be dependent on if we've got critical meetings with the departments to try and work around that, but we're not quite sure exactly where that's going to go. It might be as early as Tuesday, or it might be a little bit later in the week. So in terms of this, we'll be asking members also in the email to try and put the frequently asked questions to the employer, as well as to us. There will be a DG email, we understand, coming out. We think sometime today or tomorrow, which will give you options around more frequently asked questions. At this point in time, putting to the employee, we'll seek them and try and put them back to the employer on your behalf, but also putting them directly to the department will be helpful in terms of trying for them to understand the scope of the issue and just how challenging it's going to be for everybody in the school system over the next 10 days before school closes to deal with so much unknown. This is going to be a huge issue in terms of those people who aren't going to be vaccinated. It's also going to be a huge issue and stress on our members who do seek to be vaccinated in terms of your workload, in terms of the mental health, in terms of the conflict this will bring to schools between with parents, with teachers, with other staff, and with students. This is going to be a very difficult period. We will do everything we can to support you, and we're also going to work on what we can do in terms of supporting the mental health aspects of it because of the very challenging nature of it. And we'll also work through to represent members individually, depending on what rights we're able to negotiate for you in terms of that exemption process. So I know we haven't been able to go through everything. I know a number of people have also asked in relation to hoping to be able to use the new vaccines that are coming in, particularly the Novavax. I think those conversations are still happening with the department. That question was asked specifically this morning. And I think that's going to depend a bit on both the question of what the CHO says in terms of your ability to attend the workplace, but also what the employer response is, which is going to be different in that once the CHO says you can't go to the workplace is one thing, your employer then has to work out what they do with you, whether they give you alternative employment, whether they go down the dismissal process, which is the threat currently hanging over people in the police service. It's a threat that hasn't been implemented yet, but is certainly the natural course of where they're going. All those questions are going to have to be dealt with over the next couple of weeks. We will try and get as much information to you as possible. We'll try and use this forum, this structure for feedback, as well as written material, because of the changing nature of it, but also giving you the opportunity to deal with those issues. And we'll do a follow-up email out to those people who attended today, asking them if they've got specific questions. We've had a number of questions in the chat that we're going to try and be able to, we're going to get to all of those today, and we will try and keep today to half an hour, so we're able to make sure that in terms of that process, people have some confidence about being able to dial in and know that we're not, that this will, you'll be able to do this in work time while being able to continue your other work. So I'm sorry we haven't been able to give you as many answers as I would have liked today. We will continue. So please kind of have your views and make sure you express your view to the union office in relation to your part, to the process we'll do with today's survey and ballot of members. but also make sure that you provide the frequently asked questions both to the union office and to the department. We are unlikely to be able to answer most of your questions for the next week and a half, but at least we'll know what your questions are. And please stay involved, stay informed, and we'll do everything we can to help you through what is going to be a very difficult time. And particularly, we'll also be doing a separate teleconference from members in regional office and head office, because they are going to have different implications for them, but we didn't want to confuse today. This is primarily just talking about schools-based staff. There'll be a separate Zoom for regional and central office, because the issues facing you are going to be quite different, and the timeframes are going to be quite different, because it's not a CHO direction, it'll be an employer direction as to what happens to the nature of your work if you're unable to attend schools. So thank you very much for your time. I'm sorry if I spoke too fast, but we were trying to keep it to the half hour, and we will try and get you as much information as we can moving forward. Thank you.